Maria Isabel Cruz Hernandez was struggling to breathe back in May when her son first called the ambulance. We watched the 72-year-old diabetic get wheeled out and brought to the hospital. And a week later, she would become one of the more than 46,000 Mexicans that have died from COVID-19. It is a staggering death toll that is now third highest in the world behind only the U.S. and Brazil. And compared to the rest of the world, Mexico's mortality rate, the percentage of people who contracted COVID and died, is nearly triple the global average. Asked to explain that, Mexican health officials consistently point to one thing. Chronic diseases are the fundamental reason why COVID is more intense in Mexico, says the deputy health minister. The government says nearly 3/4 of those who've died of the virus in Mexico have had a pre-existing condition.
But the reality that we're seeing in Mexico, it's because Mexican population has a lot of problems with obesity, with diabetes, with hypertension.
But COVID's lethality here can't be explained only by chronic illness. This chart shows countries with similar rates of diabetes. Mexico's mortality rate is the highest by far. And among countries with similar-sized populations, Mexico's death toll soars above the rest. By focusing on the impact of chronic disease, critics say the government is conveniently shifting blame away from another key factor, its own inaction.
This is just bad government.
Dr. Francisco Moreno Sanchez runs the COVID response unit at a private Mexico City hospital and says the government simply wasn't ready for this pandemic. He argues a lack of quality care across Mexico's sprawling government-run public health system has resulted in many lives lost, be it from a lack of supplies or a lack of properly trained staff.
This is a very complicated disease. We need very good intensive care doctors to take care of the patients.
And that blame, he says, lies squarely at the feet of a government that in some cases still isn't taking the right steps to mitigate this crisis. A government led by President Andrés Manuel López Obrador, who recently said this when asked why he doesn't wear a mask. He says if it would help others, I would do it, but it's not scientifically proven. So that is the leader of more than 120 million Mexicans saying that masks don't work, which is just fundamentally false. Now, the government constantly defends its response to the coronavirus, saying that there is adequate care in public hospitals like this one. But whether you believe that or not, the numbers don't lie. Mexico's death toll is among the highest in the world, and it just keeps getting worse. Matt Rivers, CNN, Tijuana, Mexico.